This is a brief overview on early lung cancer detection and OncoImmune's early CDT lung. 85% of lung cancer is found symptomatically, typically as late-stage cancer, with only 16% of patients surviving 5 years after diagnosis. Most alarming is that 54% of those patients perish in the first year. As studies have shown, when found early, the 5-year survival rate for lung cancer more than triples from 16% to 52%. If found in stage 1, the 5-year survival rate is as high as 90%. The challenge for clinicians is to find those few lung cancers in a high-risk population before symptoms appear. In this illustration, given a 2% prevalence rate, there are 20 lung cancers in an at-risk population of 1,000 people. So how do you go about finding those? Is imaging the answer? As reported in a 2011 JAMA article, annual screening with chest x-rays did not significantly reduce lung cancer mortality. And though the recent National Lung Screening Trial study showed CT screening had a 20% reduction in lung cancer mortality, it also highlighted issues, including a high false positive rate, increased radiation exposure, and high cost. As seen in this illustration, half of those in the at-risk population of 1,000 people would have a false positive result, a positive CT, but no lung cancer diagnosed. This results in undue radiation risk and cost, as well as creating a large pool of anxious patients. Given these issues with CT, what else is there for early detection? Studies have shown that autoantibodies are detectable up to 5 years before a tumor is visible. Autoantibodies form early as an immune response to the presence of tumor antigens. OncoImmune's early CDT lung is a simple blood test measuring a panel of autoantibodies that has the potential for the early detection of lung cancer even prior to detection by imaging. The test detects all types and stages of lung cancer. As you see in this illustration, early CDT lung with 93% specificity produces 7 times fewer false positives than CT and concentrates 41% of the lung cancers in less than 9% of your high-risk population. There is no radiation risk, and the low-cost test is covered by insurance. So only 67 patients would undergo unnecessary follow-up as compared to 490 in the previous illustration with CT. Additionally, more lung cancers are identified by early CDT lung immediately and over the next 2 years compared to CT. As shown in this chart, CT has a 1 in 36 positive predictive value, or about a 3% PPV, meaning 35 patients identified as positive by CT would undergo unnecessary follow-up versus the 1 lung cancer identified. However, with early CDT lung, there's a 1 in 5 positive predictive value, or 20% PPV, identifying 1 true lung cancer in those 5 patients with a positive result. To summarize, early CDT lung is a simple blood test that has 7 times better positive predictive value than CT, 7 times fewer false positives than CT, and 7 times greater risk of lung cancer implied with a positive test.